Yeah. So,
Yeah.
I mean, the benefits of jaw surgery, well executed, well planned, absolutely. It shouldn't be the boogeyman. The benefits of expanding these airways, giving people ideal skeletal form, there's no question that it is the ultimate treatment that we have to date to fix these issues, get people to better health, better looks, all these things. No question about it. And it's also the technology now allows us to do it much safer, much more predictable, much more efficient with stability. So the issue is that there's a stigma because traditionally that surgery was not as predictable, not as stable, it was a long operation. So it's understandable that people were reserving it for, very extreme cases. And, when I trained this surgery, I fell in love with it. This was over 10 years ago, 10, 15 years ago.
Hmm. Hmm.
And we didn't have the technology we have now. And I still fell in love with it because of the amazing transformations that patients had. But, back then I was wiring people shut. This is all we knew at the time. We didn't have virtual surgical planning or custom guides and plates. The surgeries were 4 to 8 hours. Now I'm doing it in 1 to under 2 hours, 1 hour, 1 hour and a half. So things are much less invasive, much more predictable, much more stable. So definitely, if it's done well, there's no question that people should be running to this procedure versus trying other things. But for the audience or for people out there, I would really be careful because about where you go, because the truth is that those traditional things that made that stigma what it is still pretty prevalent uh, in our community. So a lot of
Hmm.
surgeons that do this operation are still doing it in a traditional way, and it's still a fantastic operation if they know how to do it. It's still excellent, but it still has you know some of the concerns that people had historically with the procedure. But the
The
way,
potential to be botched.
yeah, the potential for risk of relapse or instability or needs for, yeah, you can
Y-
put it that way, but the
Yeah.
truth
Yeah.
is the way we can do it now, and for surgeons that are doing it this way, it is the risk of complications. Sure, it's a surgery. There's always complications. There's always risks. There's things to be managed, but it is extremely safe and predictable and stable, and the recoveries are so much better than historical. You're not wiring the patients shut. A lot of our patients actually can go home right away. They don't have to stay at night. And after two
Wow.
weeks, most people are back at work, and the impact of their transformations are phenomenal. They're outstanding. So it's one of those things that in the next 5 years, I think most surgeons are gonna learn how to use the new technologies, and it's a different operation than it used to be. So it shouldn't be the boogeyman.